Welcome to the Certified Professional in Healthcare Quality Exam Prep video. In this video, we will explore how to evaluate and integrate external best practices, example, resources from AHRQ, IHI, and QF, WHO HEDIS outcome measures. We'll discuss the steps to evaluate and integrate external best practices.
Introduction.
Evaluating and integrating external best practices into healthcare operations is crucial for enhancing quality, efficiency, and patient outcomes. Organizations such as the Agency for Healthcare Research and Quality, AHRQ, the Institute for Healthcare Improvement, IHI, the National Quality Forum, and QF, the World Health Organization, WHO, and programs like the Healthcare Effectiveness Data and Information Set, HEDIS, offer valuable resources and frameworks that can guide quality improvement. Here's a structured approach to effectively leverage these resources.
Steps to evaluate and integrate external best practices.
1. Identify relevant best practices.
Research available resources. Begin by researching the latest guidelines, standards, and best practices published by reputable organizations like AHRQ, IHI, NQF, WHO, and through HEDIS measures. These entities provide a wealth of data, toolkits, and evidence-based practices. Relevance to organization. Identify practices that are most relevant to your organization's needs. Consider factors such as the specific health services offered, patient demographics, and existing quality challenges.
2. Evaluate the suitability of best practices.
Assessment team. Form a multidisciplinary team to assess the suitability of identified best practices. This team should include clinical leaders, quality improvement specialists, and representatives from relevant departments. Review of evidence. Thoroughly review the evidence supporting each practice. Evaluate the applicability, benefits, and potential challenges of implementing these practices within your specific context. Stakeholder feedback. Engage with frontline staff and other stakeholders to get their input on potential adoption. Their insights can provide practical perspectives on how these practices might be integrated into daily operations.
3. Customize and adapt best practices.
Tailoring to needs. Adapt the selected best practices to fit the unique needs and constraints of your organization. This may involve modifying certain aspects to better align with your operational workflows, technological capabilities, and patient care standards. Pilot testing. Before a full-scale rollout, conduct pilot tests of the adapted practices in selected departments or units. This allows you to evaluate their effectiveness and make necessary adjustments in a controlled environment.
4. Develop implementation strategies.
Implementation plan. Create a detailed implementation plan that includes defined goals, timelines, required resources, and responsibilities. This plan should also outline the steps for training, communication, and change management to support the integration of best practices. Training programs. Develop and conduct training programs to educate staff on the new practices and the expected benefits. Ensure that training is continuous and includes periodic refreshers.
5. Monitor outcomes and impact.
Performance metrics. Establish clear metrics to monitor the impact of the implemented best practices. These could include patient outcome measures, process efficiency indicators, and staff and patient satisfaction scores. Continuous evaluation. Regularly review the performance data to assess the effectiveness of the integrated practices. Adjustments should be made based on these evaluations to continually optimize the practices.
6. Share learning and experiences.
Internal feedback loops. Create feedback loops within the organization to share experiences and insights gained from implementing the best practices. This can help in refining processes and overcoming implementation challenges. External sharing. Consider sharing outcomes and lessons learned with the broader healthcare community, including through conferences, publications, and professional networks. This not only contributes to the field but also enhances your organization's reputation as a learning and innovative institution.
Conclusion.
Integrating external best practices into healthcare operations is a dynamic process that requires careful evaluation, adaptation, and continuous improvement. By leveraging established resources from recognized healthcare quality organizations, healthcare providers can enhance their services, improve patient outcomes, and maintain high standards of care. Effective implementation involves a comprehensive approach, from initial research and customization to training, monitoring, and ongoing refinement.
If you found this video informative, please like, share, and subscribe.